So welcome everybody to episode number 2 of the IACT IMDHA Presenters series in anticipation, in great anticipation, I might add, for the IACT IMDHA Hypno Expo 2019, May 17th through the 19th at Daytona Beach, with various pre- and post-conference offerings as well. And in fact, during the course of this series, what we're doing is we're talking to the people that are offering those pre- and post-conferences about their topic. They're all have all agreed to share some information with you, and also to let you know about their classes. So welcome everybody. I need to give you a little bit of information, and Karen, you can help me out back and forth with this a bit. Just so you know, this program, as I said, is being recorded, and the recording will be posted in the virtual chapter group on Facebook. It will also be posted at the IACT IMDHA website, and it will be posted at the IACT or IMDHA forum. If you're a member, you can click into the Mind Matters forum there and see the postings. And it's also on the virtual chapters YouTube channel. So a number of places that you can find it tomorrow, but just check in with IACT and IMDHA at their website, and you ought to be able to see it pretty soon, or like I said, to the forum there, because these folks tonight are going to say some things to you that are so amazing that you are definitely going to want to hear them again and again and again. So it's good to have the recordings.
And on top of all that, you get CEUs for attending tonight from IACT, IMDHA, ICBCH, IHF, and perhaps other friendly organizations as well. All you have to do is tell them that you attended tonight, and even if you're listening to this on the recording, that applies. So use for tonight's event.
Nice to know you can get credit for anything that you do here. And by the way, you may wish to notice down at the bottom of your screen, if you haven't already done it, there's a button that allows you to open a chat room. If you do that, that just might come in handy a little bit later, because people do post some things in there from time to time, or we might put a couple of web links, things like that. And when it comes time to question and answer period as well, it might be helpful there. So go ahead and open the chat room if you will, and that will be useful for you. As I said, your microphones are all muted, but you can all unmute your own microphones at appropriate times if you're called on to ask a question or something, or to answer a question rather, something like that. Easy enough to do. For those of you who don't know how to do it, down in the lower left-hand corner of your screen, most likely, depending on what system you're on, but most likely, you'll see a little microphone, and because you're muted, it probably has a red line through it. And if you just click on that little microphone, that will take you off mute. So it's a good idea to keep yourself muted when you're not talking, because too many open microphones create a grand chorus of noises and sounds that's rather eclectic in nature, truly hypnotic, but so distracting from our speaker. So there you go. Please do that. Anything else, Karen, before we start?
I don't think so. I think we're ready to roll.
Well, all right. So we are ready to roll, as a matter of fact, with the author of this book, Hypnotize Yourself Out of Pain Now, the co-author with Roy Hunter of The Art of Regression Therapy, and a guy who's written actually a number of books and work on pain management. He is a licensed psychologist and a certified master hypnotherapist who specializes in the use of hypnosis for pain management. He's a board certified by the American Board of Professional Psychology and a fellow of both the American Psychological Association and the American Society of Clinical Hypnosis. He's written several books on hypnosis for pain relief, and he worked for 7.5 years as a busy hospital-based pain clinic. So somebody who's really been in the field with pain. And usually, by the way, pain is the topic that he does, but we're taking him a little bit off of his normal mark in this conference, and he's going to be talking to us about preventing anxiety and depression with hypnotherapy. His program is a 2-day course. It's on Wednesday and Thursday before the conference weekend. That's May 15th and 16th at the hotel there in Daytona Beach. So without further ado, hey there, Bruce, how are you?
Hello.
Hello.
So good to see you, Bruce.
Hi, Karen. Hi, Michael. Hi, Donald.
It's good to have you on the call.
Thank you. Nice to be here.
You know, something I'd like to just start out with, I have a number of questions to ask you, and I think you know what most of them are going to be. But just as we're getting started, I really want to give people an idea about the conference because it's such a lovely place, such a lovely experience down there on the beach and all of that stuff. And while they're daydreaming about Daytona, I'd like them to daydream a little bit about your class as well. So can you give us an idea what just what the class will look like? How does it go? What happens in those 2 days in your training room?
Well, I had expected to teach hypnotherapy for pain management, and I was asked to do a little segue into depression and anxiety land. And it really didn't seem to be much of a problem, as I anticipated doing a 2-day workshop on utilizing hypnosis to help people to alleviate the problems attendant to depression and anxiety, because I've been working with depressed patients and clients and anxious patients and clients for over 30 years, and I've been using hypnosis for about 30 years. And hypnosis is a power tool. It empowers any other type of therapeutic regimen that you happen to practice. So the class is going to be a 2-day class. It's going to be both didactic as well as experiential. There'll be opportunities to practice techniques that I will present, some of which I'll demonstrate, and discuss different types of cases. And we'll also be making sure that we're very clear about what the parameters are of using hypnosis for treating clinical syndromes such as anxiety and depression. So there's some very important considerations that will make very specific from the get-go. And then we'll spend 2 days learning a lot and having fun.
Great. I'm in favor of fun, especially. And then learning a lot is kind of comes along second, and learning a lot about anxiety and depression comes in about third. So you got all three of them going for me. So tell me, Bruce, just generally, how can hypnosis be used to prevent anxiety and depression? I like that you're talking about preventing anxiety and depression, by the way, and to how can hypnosis be used for that?
Well, I chose to use the term prevent because if somebody learns how to use self-hypnosis, they can use self-hypnosis as a very powerful coping tool, which can prevent them from becoming depressed when they're facing adverse circumstances, prevent them from succumbing to overwhelming anxiety in many situations. But the fact of the matter is that when we're dealing as hypnotherapists or as consulting hypnotists with clients, most of the time we're dealing with we're dealing with what they bring into our office. So we have to, from the get-go, be very careful to assess exactly what's going on, because we don't want to do any harm by ignoring things that need to be addressed by other health professionals, medically or psychiatrically. But preventing anxiety and depression, well, if you practice self-hypnosis, you learn how to communicate with your unconscious mind, and depression and anxiety come up from our unconscious mind.
Mm-hmm. Nice.
So Bruce, I'm looking for the exact title of your workshop. What is your 2-day workshop called? What is the name of it?
I think it's titled Using Hypnosis or Hypnotherapy for Preventing Anxiety and Depression States.
That's
Something
exactly what we just talked about. What an apt name for it.
Yeah.
So do they correlate in any way to pain? I mean, it seems to me depression and anxiety are kind of painful, right?
Yeah. It's interesting that people that have chronic pain suffer from depression because what happens is when there's acute pain, there's anxiety and worry about what's actually going on and what's causing the pain, if the pain's ever going to go away. And then when the pain doesn't go away, and despite any type of treatment that's been rendered or the person's gone to, then the person tends to become rather hopeless about the opportunities of ever getting better. So depression tends to come up when people feel that they're helpless to do anything about circumstances that are out of their control and that are noxious, and that breeds hopelessness, and that's the breeding ground for depression.
seems to go hand in hand with pain, like a chronic pain. And I think you're the absolute perfect guy to be dealing with that kind of thing.
Well, I've dealt with it for many years, both professionally as well as personally.
So I've seen something about the AWARE, AWARE model of hypnotherapy. You can structure a hypnotherapy program and session from that. Tell me about that.
Yeah. Well, AWARE is an acronym. I like to use acronyms for an approach to essentially utilizing mindfulness, which basically means that, you know, over the years, I've seen so many patients, and many people have trouble actually accepting what's going on in their lives, accepting the reality that they're not functioning well, or that they have a condition that is impairing their social and their occupational functioning. And, you know, it's a natural tendency for people to want to avoid facing painful circumstances, avoid anxiety, avoid things that are painful. So the first letter in AWARE actually stands for acceptance, which essentially means accepting responsibility for what one does about the problem. It's different from blame. People make the mistake of saying, well, accepting responsibility. It doesn't mean you caused it necessarily. It means that you have to accept responsibility for what you do about it. In addition to that, many people, have very low self-esteem as a result of not feeling successful in coping with adverse circumstances. So acceptance also has to do with developing a sense of accepting oneself, even though one has problems. So that's the first letter.
Cool.
The second letter in AWARE stands for watch, which is like basically mindfully watching without judgment the symptoms, one's responses to circumstances, how one deals with symptoms, and so forth. Then, you go into A, which is the third letter in AWARE, and that stands for adjusting. And basically that's adjusting one's responses in light of what one watches. And I like to use the term adjusting as opposed to change, because people tend to think of change as all or nothing. But adjusting can be just like adjusting a dial or a rheostat, making little changes at a time, which is what you need to do in order to be successful in any type of change endeavor.
I love that.
Yeah, and then R stands for releasing emotional burdens that are basically weighing you down. So that has to do with letting go of things you don't need to hold on to anymore. And last but not least, the E in AWARE stands for envisioning a positive future. It's sort of like future pacing.
Very cool and very clear. And I can see how you can structure an entire program around that concept, using those concepts.
Yeah, AWARE hypnotherapy.
Yeah.
Nice.
Is that what you call your business?
I'm sorry?
Is that what you call your business?
No.
Because that's a great name. It's a good acronym. I like it a lot.
Yeah, thank you. Yeah.
There's got to be a lot of reframing that goes along in that. When you're changing pain, or when you're changing depression, what's the importance of reframing that into something else?
Reframing means, changing the way helping a person change the way they think about something without necessarily changing that something. So if you're stuck with chronic pain, the pain's there. It's not often possible to get rid of the cause of the pain if it's a physical issue, but we can change the way that we think about our circumstances. We can change the way that we view our life, the way we view ourselves, the way we view our limitations on our capacities. So reframing is essentially changing the way we think about circumstances. And that's basically what we do as therapists. That's basically what we do as hypnotists or hypnotherapists. We help people change their perceptions so that their new perceptions that they work up become more adaptive and, help them to be more happy and achieve their goals.
It's so easy for me to drift over to the pain category when I'm talking to you, Bruce, because that's certainly the way I think of you. But as we look in depression and anxiety for this, tell me about taking somebody who is in the depths of depression and feeling absolutely at the bottom of the vibrational scale, hopeless. Do you move them up slightly, incrementally? You can't just go immediately for ecstasy, can you?
No, no. I mean, first of all, it's not an all or nothing thing. Second of all, it's important to understand that what we're doing is we're not treating major depression. We're not treating persistent depressive disorder. We have to be very careful as hypnotherapists to leave that to the medical doctors. It's very important to, at the outset, when somebody comes into your office and presents as depressed, to assess whether or not they are being treated by a health professional, a licensed health professional such as a psychiatrist or a medical doctor. And if you start to see certain red flags, to not proceed with hypnosis until that person until you make contact with a treating medical doctor, or that person goes and sees a medical professional that is licensed within their scope of practice to treat major depression and other biopsychosocial types of disorders. So what was your question? Basically, how do you take somebody from the depths of despair to
Right.
a better place? You do that by, first of all, starting out by coming up with a cogent assessment of their condition and the things that you want to target for adjustment or change. And so what we as hypnotherapists are actually doing is we're using the tool of hypnosis to facilitate the change of dysfunctional behaviors, to facilitate the change of mood states and emotional states that are, not pleasant, that are noxious, that are dysfunctional, to help people to change their perceptions, their images of themselves and others. And with depression and anxiety especially, we have to target the negative thinking, the doom and gloom thinking of depressives, and the anxious, fearful, worrisome, obsessive thinking of people that suffer from anxiety. And then, of course, we also have to address the interpersonal problems that people who suffer from severe anxiety and depression obviously manifest, because when people are very anxious or very depressed, their relationships are affected. People tend to avoid other people or act in funny ways because they don't feel good. So we have to target, we have to assess, we have to come up with targets for change, and come up with that in a collaborative way with the client.
And this might, Bruce, be an appropriate place to ask Suzanne's question. She writes in the chat room, Dr. Bruce, how do you effectively assess where the client is on the anxiety and depression spectrum as a hypnotherapist?
Okay, well, I think that, number one, in my workshop, we're going to cover doing the initial intake interview with clients. We're going to practice giving an interview and coming up with an assessment of the levels of depression and the associated symptoms, as well as anxiety. As hypnotherapists, I don't think that we're not required to follow the DSM-5, but what we want to do is we want to perhaps give some scales. There are, published scales. There are lots of scales that are free on the internet that one can give a client to fill out, paper and pencil, or administer verbally. But what we want to do is we want to use some established guidelines as a way of structuring the interview to find out how bad the depression and the anxiety is, and to find out whether or not we need to confer with or refer that person to a psychiatrist or medical doctor or a licensed psychologist.
Bruce, I want to just step in there, because I mentioned this to you when we talked earlier today as well. I think one of the considerations, and you're responding to it so beautifully, is this issue of scope of practice and stuff, and we really want to be careful that we are doing what it is that we're qualified to do. That said, the other thing that I want to point out is, by taking your course, actually people are gaining more information and more knowledge, and I think their ability to do things that are useful then gets expanded in the process. But also to point out that as I'm looking at the description of your course, we're not really talking about what to do with depression and anxiety. We're talking about what to do so that depression and anxiety doesn't come. We're still talking about something preventative, and I think that's beautiful. So if we can switch for a minute, the big thing now, and for the last, 20 years maybe, but at least the last 10, everybody's turning to mindfulness. And I know you've got something to say about that. So what's the role of mindfulness in working with anxiety and depression?
Well, I'm glad you asked that question. Mindfulness essentially means learning how to be present without distorting the present with judgments. And that's very hard because it's a natural human tendency to judge things as good or bad. We do it all the time. You know, of course, some people are more judgmental than others, but we all judge. And it's an adaptive characteristic of us, because if we couldn't judge things as good or bad, you know, it would be easy to get hurt. But what happens with people that are depressed and what happens with people that are anxious is that people who are depressed or anxious tend to blow things up out of proportion and catastrophize, and tend to view circumstances in a global sort of way. So if like one little thing goes wrong or doesn't work and somebody is depressed, they're going to interpret that as meaning that everything is wrong and that nothing is ever going to be right. And that proves that he or she is defective. If one little thing goes wrong and somebody's, you know, very anxious, let's say somebody has flying anxiety, you know, flight fears. So like they're on a plane and they hear like a bump as the plane is flying along above the clouds, they immediately interpret that bump or that sound as meaning something's wrong with the engine and the plane's going to crash because the engines are going to fall out. So what we have to do as hypnotherapists is, number one, help our clients develop skills to identify that sort of anxious or doom and gloom thinking and stop it in its tracks. Yeah. And that takes time. It doesn't happen, as Karen, you were mentioning earlier, all or nothing, like suddenly, you know. I mean, we're all constantly, like the Buddhists say, always suffering. We're always in the struggle. And we have to learn as, and I'm not an expert on Buddhism, but as the Buddhist philosophy is, we have to learn how to suffer well, how to be with our suffering, how to deal with the adversity of everyday living, and just be with it and stay with it without making it worse than it is by condemning everything and condemning ourselves. So mindfulness is really a really cool philosophy. It's not easy to do, however. So, you know, we could do a little exercise right now, which I'm sure everybody that's watching is familiar with, and that is take a moment to just simply close your eyes, and with your eyes closed, sitting comfortably, just pay attention to your breathing. And just notice your breath without trying to change your breathing as you inhale and as you exhale. And when you notice your mind wandering, as it will, as soon as you're aware that your mind is wandering, just gently bring your focus back to your breathing. And just notice your breathing. Notice if your breathing has changed. Take a moment to do that. And when I count to 3, just open your eyes and come back to this conversation. 1, 2, and 3. Come back, open your eyes, come back to the conversation. Did anybody's mind not wander?
I'm sorry, I'll be back in a minute.
Yeah.
So
except you were kind of distracting me by talking.
Yeah. Where were you going? You're drifting off to some pleasant memory or daydream, or thinking about what you're going to say during your segment of the show, or, I mean, everybody.
No, I was just thinking about my breathing.
Oh, well, that's good. But your mind must have wandered at some point. No. No.
My mind was wandering towards the next question, actually. Because
if I'd had more time, it might have.
Yeah.
So here's what I wonder, Bruce, what I noticed about that, because mindfulness is a lovely thing. And what I noticed about that was you counted us back up. You know, it wasn't just mindfulness, but it was mindfulness coupled with a little bit of hypnosis. And in the same way, hypnosis and cognitive therapy work really well together. And I know that that's also a part of the way that you work. So can you talk about that a little bit?
Certainly. Counting you back up, I wasn't thinking of it necessarily as hypnosis. I was just sort of thinking that, well, I don't like to just like come right back up abruptly. It's like if you're in bed and the alarm rings and you realize that, you had skipped, you forgot to set the clock back or something, and you realize, oh, Jesus, I'm going to be an hour late for work. You pop up out of bed and you just don't feel rough. It's easy to just come back up more gradually. The way that I work is that I was trained as a cognitive therapist in, Aaron Beck's mood disorders clinic at University of Pennsylvania. And I used cognitive therapy and cognitive behavior therapy for quite a while until I learned hypnosis. And then I discovered that hypnosis is such a great tool because it makes therapy with cognitive behavior therapy techniques, briefer but deeper. It actually allows us to go deeper through the use of hypnosis because we get through that barrier. We open the doorway to the unconscious or subconscious mind, and it makes it possible when you have rapport with your client to get information that individual is now able to become aware of that they were unable to be aware of earlier when they were in a completely alert, normal state of consciousness, if there's such a thing.
I'm sorry. Go ahead. I'm sorry, Bruce. I didn't mean to interrupt.
Yeah, it's okay. You stop me from talking.
I was just going to say that since we're doing this mashup of hypnosis and cognitive behavioral therapy, let's do some more new school stuff. Don Pelles wants to know about positive psychology and the relationship here. So that's another mashup of what you're doing, hypnosis and the idea of positive psychology. Don says he's heard a couple of talks by Martin Seligman and was pretty impressed by the commonalities of what we do in positive psychology.
Yeah, I can't really speak to positive psychology per se. I'm not very familiar with Marty Seligman's work other than the early seminal work that he did on learned helplessness. And, he discovered, of course, that when people discover, or actually it started with the early research with rats, that no matter what they did, no matter what button or lever they pressed, it didn't stop the shock from occurring in the panel in the cage in which they were standing. And he made the extrapolation from that early experimental psychology research to everyday life, where people become depressed when they start to feel or believe that it doesn't matter what they do, no matter what they do, they're going to be buried. No matter what they do, they're going to be trapped. And when people feel trapped, they start to feel hopeless. And when people start to feel hopeless, what often happens is they start to either internalize anxiety or they start to externalize anxiety. People become depressed when they internalize anxiety and anger. People become angry and destructive when they externalize and act out. So positive psychology, I think, developed out of an impetus to move away from diagnostics, move away from labeling people, the whole DSM thing, and start to think in terms of, they talked about inculcating, developing optimism, and optimism as a skill, as a coping skill. I think that Marty Seligman wrote a couple of books just on optimism, the optimistic personality versus the pessimistic personality. So positive psychology is about learned optimism, which is the opposite of learned helplessness. And, it's related, but a little bit different from mindfulness. And it certainly has an important role to play in helping people to develop the skills to help prevent them from falling into depressive states or anxious states, anxiety states.
So Bruce, you also, as I mentioned at the top of the show, you wrote that book with Roy Hunter about regression therapy, and I assume that that's kind of one of the things that you do, and so it makes sense to ask about the sort of emotional burdens that people have and hypnotic techniques that can be used for that relative to anxiety and depression.
Yeah. I've found over the years that utilizing regression techniques is often very helpful in discovering underlying conflicts that need to be addressed and need to be resolved. But you got to be very careful when you're dealing with somebody that's depressed to not do regression in a way that could put them back into a more depressed state and re-traumatize them. I find that regression therapy, hypnoanalysis is often very helpful in uncovering the root cause of an anxious issue, a phobia, or the initial sensitizing events and the initial precipitating events for people's generalized anxiety disorder or panic disorder. But treating people or working with people that are depressed, it becomes much more delicate. Got to be very careful. And I don't advocate utilizing hypnotic regression therapy as a first course of action or as even a second with people that are depressed.
So at least not back to ISEs or SSEs. I mean, certainly you can regress back to resources.
Yeah.
Resources, but regressing them back to an ISE or an SSE might be kind of cruel.
Yeah, regression to cause.
Yeah. You know, the research shows that one of the most effective components in psychotherapy for depression is behavioral activation. So basically motivating somebody to start doing the things that they avoid or that they don't want to do. Even they don't feel like doing it, getting them to do it, and you got to do that very gently. And in order to get them to do something that they don't want to do, like let's say go out and take a walk at the mall, or go to the movies, or go to a Chinese restaurant if the person likes Chinese food, is to remind them of a resource from the past that enabled them to do stuff that they didn't necessarily want to do, that they did, and then they felt better. Or to remind them of the last time they had a good meal at a Chinese restaurant or had fun walking around the mall. So regression to positive resources, absolutely, Karen. It's you know, a very important component of this.
And puts them back in touch with what that feeling might have been like, so they can actually imagine it again for the future and know that they once had it. If they had it, they can have it again.
And yeah, it's very important because people that are depressed in particular are disconnected or dissociated from those feeling states. And in cases of real bona fide clinical depression, people are numb. They can't even feel. In fact, one of the items on the famous Beck Depression Inventory is that, you know, I don't feel anything at all. I'm just numb, you know. So that's like a higher level, more severe level of a depressive state. You know, and it's kind of a defense mechanism as well to protect the individual from that awful abyss.
Right.
So,
but if you can get them to feel pissed off, that's something. If you can get them
that can be very important because depressive people, you know, there's a lot of theories about what depression is, and you can talk to, you know, 10 different psychiatrists and get different formulations or definitions of what depression is. Kind of like talk to different hypnosis practitioners and you'll get different definitions of what hypnosis is. But from my experience, when you work with somebody that's depressed, I've always found, I mean, not always, but I'd say like 99.9% of the time, people that are really depressed are internalizing anger against themselves. They just feel that they're not right. They feel that, you know, they've made lots of mistakes, that they're a failure, that, you know, it's all their fault, that they're to blame, which is one of the reasons we got to be very careful when we work with people that are depressed, because if they get the feeling, which they do very quickly because of their, you know, depressive thinking, that they're not doing it right, that they're not a good enough hypnotic subject, or that they can't do self-hypnosis when you teach them how to do it, they start blaming themselves. They don't blame you, the therapist. They blame themselves because they're not good enough. They're not smart enough. So, you know, it's very important to take that into account and to help people get off the hook. So one of the first things that I do when I work with nitty-gritty here, when I work with somebody that's depressed, is in the first part of the session, I let them complain. I let them express their negative thoughts about things. Because what that does is it externalizes their depressive energies and their anxious thinking. It externalizes it. And then once they've expressed those feelings and those thoughts, then we do some reframing at a waking state. And then we do some hypnosis to fix in place the reframes that we've done in a waking state.
Nice.
Right. Yeah.
So Bruce, I want to get in this question that I've got here about the 7 keys model. But before I do, I just want to slip something in because it's shown up on the question feed as well. Someone was asking about things like EFT and stuff like that. And we've got Melissa Tiers who's big on her anti-anxiety protocol and God, what are those things? The bilateral stimulation, all these sort of things. Do you do any of that stuff, or is this completely separate from?
Yeah,
Spanish
the tapping therapy, tapping the energy meridians, whether you're following, the emotional freedom techniques, which is the EFT, or I was originally trained by Roger Callahan in thought field therapy, which is tapping techniques that he developed, which came before EFT. Those are pretty harmless. And while there's debate as to whether or not they constitute hypnosis, the fact of the matter is I found them to be very useful as easy, portable coping tools that a lot of people respond to very positively. And you know what? If somebody can tap a few points on their body, on their head and their neck and their collarbone and under their arm or whatever, and feel like they have more control, that counters learned helplessness, and that counters hopelessness.
Nice. Good. All right. So tell us about Cheek and Lacron's 7 keys model of psychosomatic disorders.
I've always been so enamored with David Cheek's work and the work of Leslie Lacron, who was his collaborator for such a long time. And I find that the model that they developed to be very elegant and very useful. It can be used both in an interview format, but it's best used when you're actually when you have your client in hypnosis, and then you do some hypnotic uncovering to find out what are the contributing causes to a person's presenting problem that you're targeting. So the 7 keys would be, and there's an acronym for that too. I don't take credit for coining that acronym. It's called the COMPASS acronym, and the letters stand for conflict, organ language, motivation, past experiences, identification, self-punishment, and self-suggestion. But basically, what we're looking at here is when somebody doesn't get better with direct suggestion and hypnosis, when somebody doesn't use techniques that they've been taught, that they've been given an opportunity to rehearse, when somebody just doesn't seem to be getting well, we want to look for reasons why they're not responding. And very often, the reasons lie in some type of unaddressed or unconscious conflict, which lies below the surface of their conscious awareness. The 7 keys provide a framework for finding out what those what the blocks are. So in almost most of the cases that I encounter as a psychologist, when people come to me with problems in living, there's some underlying conflict where the person just doesn't really feel that they can get better using the techniques that are available because, well, it could be because they're not sure whether or not they want to do one thing or do something else, or there's an ongoing, stress in their life that isn't being addressed, like somebody at work that's harassing them, let's say, that they're afraid to confront or afraid to address the issue. Or there could be secondary gain, some type of secondary benefit, which is often the case with chronic pain conditions, where you're getting some kind of disability pension for regularly reporting that you're not functioning well. Or somebody could be traumatized even on an unconscious level from a past experience that they're not aware of, that using hypnotic uncovering and regression therapy we can bring to light and help them to reframe that experience. Or it could be but psychodynamic people talked about masochism, which is self-punishment. When people internalize anger, which is the case in most cases of depression. When you're angry at something, you want to lash out and punish it. You want to get your pound of flesh, So, people that are depressed are often, very, they basically want to suffer. They feel they deserve to suffer because they're not good enough. So the 7 keys provide a framework for exploring which of those factors are most active that could be preventing somebody from moving on.
Nice. All right.
The acronym exists for some reason, right? Why conflict first? I mean, just because C was a good way to start a word, or is there a reason that you get to conflict first?
Well, it's not necessary to start with conflict, but as Roy Hunter and I have taught and have written about in our book, The Art of Hypnotic Regression Therapy, what we do is we go through each of the 7 keys utilizing idiomotor questioning while the client is in hypnosis, and we get an answer as to whether or not that particular key is contributing to the problem that we're focusing on. But almost all the keys, not almost, but all the keys are basically rooted in conflict, because if you don't address an ongoing stressor, basically there's a conflict, right? Like, okay, this thing is a problem, but I'm afraid to address it. And so I should address it, but I'm afraid to address it. That's a conflict. When somebody has secondary benefits from being sick and not being able to work, of course, they're not making it up. I mean, I'm not talking about malingering. We're talking about somebody that, they maybe don't want to go back to a job that they hate, but at the same time, they don't want to be sick, so there's a conflict. When somebody is identification is another one of the keys. Somebody's identifying with somebody from their past, like a father or a mother figure that had a similar problem. Well, they want to be close to that person, but on the same token, they don't want to be dead because that person is no longer living, and maybe that person abused them, but they still have an attachment to that individual because they spent good times. So there's conflict there, you see. And when somebody, when somebody punishes themselves, it's not like they actually consciously, want to punish themselves, but there's this underlying drive to punish oneself, to not get well because they don't think they deserve it. So all of the keys really are rooted in conflict. And, Freud was right in that respect, that, all neurotic disturbances are rooted in conflict.
Of course, he didn't practice mindfulness, which is really the problem there.
No, he took cocaine.
And so does forgiveness have to be a part of this? Forgiveness of self and forgiveness of others to really resolve some of this conflict?
Yes. Actually, that's the letting go part. That's the R in aware, releasing unnecessary emotional burdens. I mean, basically what ends up happening in therapy that actually works, whether it's brief hypnotherapy or, people that go for therapy of a traditional type, is that they absolutely at some point, in order to get well, have to forgive the perpetrator, and the perpetrator it can be themselves. They have to forgive themselves. People don't get better often because they say, well, look at all the damage I've already caused. I don't deserve to get better. What's the point? You have to let yourself off the hook. You have to let the person that abused you, eventually you have to forgive them. You may not forget. And, it just means letting it go, giving it up, so that you give it to God if you believe in God. And you can then move on without the weight of that unnecessarily emotional burden that's been weighing you down. So forgiveness is, it's essential to completing therapy, in my opinion.
Okay, so Bruce, we've only got 1 minute left or something. It's amazing how the time goes by here. So there is one question that's shown up in the chat room. If we can, if you can maybe, however quickly you can do it, and I'm sure that there's probably a lot more to say. But the question is, what is the underlying conflict with performance anxiety?
What's the underlying conflict with performance anxiety? Oh, well, I think that in most cases of performance anxiety, that I've encountered, including my own performance anxiety that I've been known to suffer from. The conflict is between, doing okay, being acceptable, but not necessarily being great. Feeling sometimes a lot of people that have performance anxiety, including yours truly, want to knock it out of the park. And just being okay is not good enough. And then that tends to lead to self-blame or basically it's like, well, I didn't say what I wanted to say the way I said it, so that must mean that I'm not doing a good job. Or the other piece that Albert Ellis, the famous rational emotive psychologist, would say is that there's a tendency that people have that have performance anxiety where they believe that they must not mess up. They must not make a mistake. They must be perfect, perfectionism. So if one can overcome that sense of having to must, that masturbation, called it masturbation, that shoulding on oneself. Don't should on yourself. Why should you have to be perfect? Why can't you make a mistake or stumble over your words or not necessarily hit that high note? It's okay. And then the performance anxiety will dissipate because you can then relax and actually be mindful.
Nice. So everybody listen to this. We've got 2 days, the 15th and the 16th of May, to hear more from Dr. Bruce here about preventing anxiety and depression with hypnotherapy, because all we can do in 45 minutes is just kind of scratch the surface, of course. And not only is Bruce going to delve into these things much deeper, but I'm sure you're going to learn a lot of techniques, a lot of things that you can do, and it's going to be a wonderful time. So bear in mind, 2 days before the conference, 15th and the 16th, if you haven't gotten your plane tickets yet, make adjustments to those schedules so that you can be there. And it's going to be lovely. And Bruce, I'm sorry I had to cut you off so quickly, but we need to move on. You've done a great job and been real helpful with us here tonight. And so something that we always like to do at the end of a segment like this, because I know that these people, we have left them wanting more. And so we're going to give them a chance. I'm going to unmute all of the microphones at the same darn time, so that everybody can say thank you to you, and then we'll move on to the next segment. So thanks a lot, Bruce. We really appreciate you.
Thank you.
Thank you. Thanks for coming in. Very informative.
Thanks, Bruce.
Thank you.
Bruce, it was an honor.
Thank you, Dr. Bruce. You're an ace. Thank you.
Thank you.
I think it's in cards, Bruce.
Thank you.
Thanks, guys.
You need to find that phone.
Okay, now once again, I have muted the microphones, and I've lost my cohort here. There she is. Karen, hi again.
Hey, and we are back for part 2. Thank you for joining us for Don Pelles. Coming up next, Don is a hypnotherapist in Kensington, Maryland. He works with his clients to resolve their difficult issues and thus transform their lives, utilizing hypnosis and neuro-linguistic programming. Hypnotherapy is Donald's 3rd successful career. Believe it or not, he was previously a mathematics professor, making significant contributions to the field, and later he was a software developer, left brain stuff, and he goes all the way right brain and becomes a hypnotist. How about that? I want to hear about that, Donald. Donald's very happily married to Rosalind. They have Rosalind or Rosalind, Don?
Rosalind.
Rosalind, thank you very much. And they have 3 grown sons and 4 grandchildren. Thank you very much for joining us. And I am very intrigued. You're going to be doing a 2-day pre-conference on core transformation. Is that correct, Don?
That's correct.
Now, I know Michael teaches core transformation. I hear people talk about it all the time. And what I'd like you to explain to me first is, what is core transformation?
I'll tell you that in a minute, but I have to say, I really think we use all of our brain all the time. This left brain, right brain stuff,
I would agree with you. I just, we of software engineer and mathematician and hypnotist necessarily butting up against each other in the same sentence, right?
Yeah, but you have to use logic in hypnotherapy, and there's a lot of intuition and mathematics and software, so using your whole brain. Okay,
so I want you to use your whole brain now to explain to me, so what is core transformation?
Okay, well, core transformation is it's a way of working with people, with clients, and you can also work with yourself. It's kind of a template. It's a set of steps that was developed back in the 80s by Connie Ray Andreas, and it's applicable to a wide variety of issues. It's a form of parts therapy. Why am I getting an echo?
I don't know. I'm hearing that echo too. Is it NLP or is it hypnosis or is it a combo platter of both?
Well, I don't distinguish. It grew out of NLP. There's a lot of NLP in it. But I like to think of it as you're working with both the conscious and unconscious aspects of a person. The process itself is trancy. Some people do it, they induce hypnosis first, and I don't do that. But people that go through core transformation are almost always in various levels of trance at different parts of the process. Sometimes really deep levels. It depends on the person. And I remember this one woman after, I don't know, it was maybe an hour and a half core transformation session saying, wow, I was really deep. But there was no explicit hypnosis there. It's just the process itself.
Can you walk me through her session or maybe a memorable session that you've had to kind of give me some more clues?
Her session, I don't remember that well. Yeah, I mean.
A memorable session would be fine.
I worked with this guy. The guy had come to me to stop smoking. And you start out, so it's a form of parts therapy, and you, there's still that echo.
I'm not hearing it, by the way, Don. So.
Okay, that's fine. It's just when I talk. So you're working with a part or an aspect of a person. And you begin by asking the part, what do you want? What's your intention, basically? What do you want? And so with this guy, we were working on smoking cessation, and the part was the part of him that wanted to smoke. And when he asked it, what do you want? The part said, I want to kill you. I want you to die. And his perception of the part was that it was a demon. And it was out to get him, and it was making him smoke, and that's what the part wanted. So then what you do is you say, okay, invite the part. First you appreciate the part because we know there's a positive intention somewhere. That the part ultimately has a positive intention for the person, even though it's not apparent. Certainly not apparent when it wants you to die. So then you invite the part to step into what it would be like if you died, if the person died. And this sometimes it starts out this way. Maybe what the part wants is peace. And I forget the actually I think I have it here somewhere, but I forget the details, but it might be negative for a couple iterations, and then it goes positive. Because each time you say, if you have that, what the part wants, then what you're addressing the part. You have the client address the part. What do you want through that? What do you want through killing me that's even deeper or more important? And then there'll be something else. We call it's an outcome that the part wants. It will usually pretty quickly flip to something positive. And in this case, it did. And you keep iterating the question. If you have that, then what do you want through that? And you're addressing the part, not the person as a whole. that's even deeper or more important. This man got to fulfillment.
Yeah.
Fulfillment. And I recognized that, well, it seemed to me to be a core state, and there's a way you can test it to see. A core state is a state of being. It's a high-level spiritual or existential state. Things like peace and love and beingness and wholeness. Those are typical core states. With him, it was fulfillment. The interesting thing about that, and then you invite the part to step into that core state as a state of being. And you go back down these chain of outcomes. If you have fulfillment, how does that transform? How does that change? And we eventually get back down. If you have fulfillment as your core state of being, how does that transform wanting to kill this guy? And the part says, well, I don't want to kill him. And if I have fulfillment, of course I don't want to kill him. So we went through, so this is the first couple steps of the core transformation process. There are other steps. You invite the part, you ask how old is the part, and then you invite it to grow up, and eventually you're going to integrate the part with the person, and that fulfillment becomes his core state of being. In this case, fast forward, the guy didn't stop smoking. He didn't stop smoking then. I happen to know that he did sometime later. He didn't stop smoking, but he said, my gosh, this changed my life.
Yeah.
The whole process, he said, it changed my life. It turns out he had been a journalist in a Middle Eastern country and had had to leave out of fear of his life, and he'd kind of lost himself. And after that session, he found himself again. He became an LGBT activist. He took up writing again. He took up journalism again. He completely transformed himself. And he's still going. And a couple years, maybe 3 years ago, I noticed on Facebook he had put out that he had stopped smoking. So I asked him, kind of almost as a joke, I said, can I take credit? He said, yes, definitely, you can take credit.
That's great. You know, Don, I got to tell you, by the way, I had the demon nicotine cast out of me when I was a young man. So it's
kind of a, what do you call it as a priest? You call it an
exorcism.
Yeah,
that's right.
He brought 10 of his friends with him. But I'll tell you what.
Exorcism.
Yeah, I wanted to ask you a question that I warned you about. I hope you saw my email. Because
yeah, I did.
The thing that I know is that the hypnotherapists who haven't experienced core transformation or haven't taken a training from somebody like you don't necessarily know what it is. And while we appreciate your description, a lot of hypnotherapists think in terms of, is this a smoking technique, or is this a weight loss technique, or is this a overcoming personal history technique? So I'm thinking, as you described to us a number of experiences you've had, what are the kinds of things that you have used core transformation for?
Okay, and in response to your thank you for letting me know in advance, I have a list. But it's very good for things like habits and addictions. So you're dealing with the part that's running or responsible for the habit or the addiction. Smoking, cocaine, alcohol, nail biting, worry, the part of you that worries, sleep issues, the part of you that won't let you go to sleep or doesn't want you to sleep. I'll have a nice story about that too. But eating issues, food choice, overeating, and also you can use it for positive things. The part of you that wants to be slim and fit. And when you do that, it tends to enhance, to strengthen those motivations. Performance issues, physical pain, yes. Grief, anger, procrastination, the part of you that puts things off. Trust, either lack of trust or being too trusting. Feeling inferior to other people or feeling superior to other people, which some people do. Shyness, depression, course, depression can mean a lot of different things, and avoidance, something you're avoiding. So, and in other words, just about everything you can think of. Anything. And the paradigm is there's a part of you, it's not all of you, there's a part of you that is in charge of running, causing this behavior, thinking, or feeling. And we're going to work with the part to find out what it really wants, which is a core state.
Nice.
Yeah, it sounds like parts work. And then you get some resistance pop up. How do you deal with the resistance?
Well, the process can stall at any of a number of points, and you might call that resistance, but in core transformation, we just think of it as another part. So there's some part that wants attention, some other part besides the one you started with that wants attention, that doesn't like what's going on, that is somehow blocking the process. So for instance,
who's negotiating now? The part that wants attention and the part that wants...
Well, as the guide, I'm guiding.
Right.
I'm not negotiating, but when I ask the part, well, I have the client ask, I don't ask it directly, but at a certain point you ask the part if it wants to, you'll say, well, you start out, you say, go inside, ask this part, how old are you? And the part will come back, I'm 7. So all this time a 7-year-old has been in charge of this whole area of your life, and it wants oneness, but it's 7. So how much better, basically I invite the part to grow up. And usually if I phrase it right, the part will agree to that. But sometimes the part says, nope, I don't want to grow up. So then my presumption is, well, there's another part here. So we'll politely ask, can you ask this part if we can deal with this second part that's preventing it from growing up? And the answer is always yes, because the part is stuck anyway. So now you ask the part that is not permitting this other part to grow up. What do you want? And you go through. So in a sense, there is no resistance. We might have multiple parts, and sometimes we do. It can get very complex, very complicated. And we'll teach you all this in the workshop that I'm going to do, which unfortunately is at the same time as Bruce's. But dealing with multiple parts, I worked with a client the other day, 3 parts came up. And we dealt with them all in turn, and we eventually got back to the first part. And so that's my answer to how you deal with resistance. There isn't any. They're just different parts.
Nice. Well, you know, and you know, of course, Don, this is one of my favorite processes in the whole.
I know.
as well, and I have such admiration for Connie Ray Andreas and the great work that's behind it, and it's nice to that you have that legacy behind you as well, and gosh, you've been teaching this for a lot of years, have you not?
Well, I was really fortunate. I've actually only been doing hypnosis and NLP for, it'll be 12 years in August. Like I said, it was the 3rd career. But right when I started, I needed a program for weight loss. So I had this book written by a woman named Judy Pearson, which was largely an NLP book called Why? Weight, Hypnotherapy, and You. And the very first chapter is a version of core transformation. And I wasn't happy with it. It wasn't enough. So I bought Connie Ray and Tamara's book, Core Transformation. And I learned it from the book. And I started using it with clients. I started using it with myself. It was over 3 years before I actually attended a workshop with Tamara. And after that, I did it better. But you can learn it from the book. The best way really is to take a workshop.
Sure. And the nice thing is, by the way, that this is a technique, if you will. I'm looking for the right word. I think you used the right word at the beginning of the interview, and that was you referred to as a template.
Yeah.
I think that's really a beautiful way to think about it, because for a variety of reasons. For one thing, it's a really great reframe on scripts, because I so don't like scripted scripted sessions or anything to quite organize that tightly. This, I would say, is easy in the harness, if you will. There is a path, there's a logical sequence to it.
Yes, and it is laid out, but what I've noticed, I noticed fairly early on when I watched Tamara, when I watched videos of Connie Ray doing the process, is even though it is a sequence of steps, they are so flexible in how they do it. And I've tried to emulate that. And that's really key to doing it well, I think, is learning that flexibility. Of course, you start out by step 1, step 2, step 3, but they are really flexible in how they ask the questions, how they respond, and so forth.
Mm-hmm. By the way, oh, go ahead. Karen.
Is this a one-session technique, or can this be taken over several sessions?
It can. It goes anywhere from 20 minutes to over 3 hours. So if you have an hour, or I don't like hour sessions, hour and a half or 2 hours, but if you have a 2-hour session, you start a core transformation at 30 minutes, and it turns out to be a long session with a number of different parts, you're going to have to cut it off and then resume later. So yeah, you can do that, and I have done that. I like to do it in one session, but sometimes you just can't.
There's a question that showed up in the chat room, and I think if I'm interpreting it right, I'll handle it for you. If I'm interpreting it right, Don, it's as we were talking about parts, and you said sometimes you're dealing with multiple parts. The question in the chat room is so which part is the main part? I'm curious as to how you might respond to that. It's an interesting question.
I don't make a judgment that way.
Yeah.
So for instance, you're dealing with a part, you're working with a part, and the core state is peace.
Mm-hmm.
The part wants peace. And then at a certain step you ask, is there any objection to peace being the person's core state of being from now on? Core state of being. And then a part pops up, says, yeah, I object. That's not safe.
Mm-hmm. Yeah.
There's a concern about safety.
Mm-hmm.
So which one's the main part? I don't know.
Yeah.
It's not important.
Well, I think what's useful in the question is that there's sort of a presupposition that parts are a certain way of thinking about parts. And
Mm-hmm.
and I don't think that's quite how we're doing it here, is it?
Right.
It's another issue that needs to be resolved. I mean, I always like to tell people, and I don't know how you answer this, so forgive me if I'm stealing this moment from you. But I always like to tell people that there really aren't any parts. You know, that this is the way that we talk about human experience, and so it's a useful device. But there isn't a main one because they really are all us in the first place, and various.
Yeah, I'll accept that. I'll accept that. Yeah, I mean, maybe they're made up. That's fine, but think of it as aspects of yourself. Different aspects.
Or aspects of an issue. Could it also be used to work out aspects of an issue? Weight loss might have a bunch of different aspects.
Yes, that's exactly right. Weight loss could include food choice or addictions to food. It could include overeating. There's probably a part that wants to lose weight and a part that feels you can't lose weight.
Right.
There's going to be a lot. There's anxiety, part that's anxious about the whole thing. So a lot of, you could say, if you didn't use the word parts, there are a lot of aspects of your personality, your psyche that are involved.
Mm-hmm. So Don, there's a
I'm sorry, go ahead.
There's a question in the chat room too, and I think you answered it, except that it really is the definitive one. So we want to make sure that that they understand this. Is there what book would you recommend, Donald?
The book I would recommend is called Core Transformation.
Absolutely.
By Connie Ray Andreas and Tamara, her sister Andreas. Oh, that echo is bad. Everything I'm saying is echoing about a half a second later.
I'm so sorry you're having that because I'm not, and I'm not aware that
Okay.
anyone else is. Nobody has
I
mentioned it.
can hear
It's
it.
just, it's,
Really?
I can hear it.
okay, so it's not just a part of me.
You may have the same parts, Don. We don't know.
Maybe.
What, what, is,
That's a little intimate, but
what,
You alluded to core transformation as being kind of formulaic in a way. Are there steps?
yes. There are 10 steps laid out in the book. Some of them just take a little bit of time and some of them take a lot. And the first step that I was describing is eliciting what we call the outcome chain, and the core state is the last step in the outcome chain.
What happens if you miss a step?
Say that?
What
Say
happens if you miss a step? What happens if you miss step number 4?
You don't.
Okay.
Well, you usually don't. I mean, I don't know how to answer that. I mean, I was just talking about flexibility. So sometimes you might do, the first 2 steps are eliciting the outcome chain and then reversing it and transforming the part. Now you could stop there. You've done some really good work. So yeah, you don't have to go through the whole thing.
Yeah, in fact, Don, I've even had an experience with a client not too long ago where we weren't intending to do core transformation, but we began with getting to a core state. And it was quite satisfying for the client to just have a recognition that this core state seemed to be sort of underlying all sorts of stuff. We didn't even do the reversing the chain. It was something that happened rather conversationally. So, but each seems to lay the foundation for the next thing. Isn't that right?
Yeah, that's right. But just to speak to what you said, I was doing core transformation, but this one time we asked the part, what do you want? The part said peace. That was it. That was it. And I checked because it might actually be something else, but it was peace.
Nice. So you said at the very beginning of the show, we were asking you about different things that memorable sessions. And when we were talking, maybe just a little bit after that, you referred to using it with sleep with somebody, and you said, I have a story about that.
Yeah, and this is interesting, especially with respect to regression. So this woman came and said, she said, I haven't slept in 20 years. Now, of course, she had probably slept some, but she hadn't slept well in 20 years. So we worked with the part that didn't want her to sleep. We might have done some other things, and basically the issue resolved. She came back saying she was sleeping. And then she said, I realized what happened. She said, 20 years ago, I was about to be married, and my bridegroom-to-be stood me up on the day of the wedding. He just walked out or didn't show up, and that was it. We didn't get married. She says, I went over to my girlfriend's house, and I said to myself, if I don't go to sleep, it won't be over. And that had been 20 years ago, and she hadn't had a good night's sleep since then. Now, the interesting thing was, though, that the insight came after we had resolved the issue. And a lot of talk therapists, and I think a lot of hypnotherapists would think of working the other way, that you find the cause, and then that'll resolve the problem. But in this case, it was the opposite.
Nice.
Yeah. It's also a very non-directive process. We don't tell the part what to do. I work with this woman. This woman called me up. I'm in Central Maryland. She called me from St. Mary's County, which is way southern Maryland, down where the Potomac comes into Chesapeake Bay. It's a 2-hour drive.
Mm-hmm.
And she told me this story about how she had been an alcoholic and she had been dry and she'd been sober for several years. And her husband, don't ask me why, invited her to a wine tasting. And she thought, well, I can probably just have a drink or two and a sip of wine, I'll be okay. So she went to the wine tasting and she started drinking again. She said, this has to be one session because I'm not going to drive 2 hours and back more than once. So I said, okay, we'll do the best we can. I did a 2-hour core transformation with her with the part that wanted to drink. And I don't remember what the core state was, but the session seemed to go pretty well. She emails me a week or so later, an angry email saying, you told me I could just drink socially. I could just drink a little bit, and I'm finding that impossible. I wrote her back saying, I told you no such thing. We don't know what the part concluded or how it worked out, but we did the process and it'll work out. I didn't hear from her for about 3 or 4 weeks. I get a second email from her saying, I've stopped drinking completely. Thank you very much.
Nice.
Yeah. But I hadn't told her anything, about particular outcomes or behaviors. We just trusted the process, and eventually it did work out.
So as folks are listening to this, I want to make sure that they really appreciate the fact that this is a major piece that you can learn and that you can add to your toolbox. And who better to learn it from than somebody like Don, who's been authorized by Connie Ray Andreas to do this training and who will give you some real hands-on experience. The book is fantastic. There's a video that's fantastic, but nothing really takes the place of being moved through the process. There's this.
And the class is a lot of hands-on. We'll talk about it for a while. We'll break up into pairs and work with each other. We'll talk some more, answer questions, break up into pairs. That's how it works. And it's a very thorough training.
And it's a 2-day course, right? Yes. Wednesday and Thursday. Again, the same time as Bruce Lipton's. So make sure you bring all of your many parts. Sorry, not Bruce Lipton.
Bruce Eimer.
Sorry, Bruce.
So you have to choose.
Yeah, exactly right. So you have to choose, or you just have to have multiple parts. By the way, also, I don't know what to say.
Maybe you can team up with Karen and she can.
That's it.
Yeah.
Can transformation be done as self-hypnosis? Can you do it on yourself?
Yes, you can do it on yourself. You can go through the same process and do it on yourself. And I have done that. I have different parts, by the way, might have different core states if you do it multiple times. The first time I did it, the core state was, I think it was beingness. And then sometime later, another part found a core state of nothingness, which was kind of like the other side of beingness.
Exactly.
I get Camus, right? Or no, Sartre, Jean-Paul Sartre, right? Being and nothing. Much later, I was working with a part, and this part, as its core state, wanted godness.
Wow.
And I could not explain to you what godness means. The best explanation I have is just walking out under a starry sky and feeling that presence of godness. And I'm still not sure what the part meant, but it's very nice.
And one of the lovely things about this then is the being able to step into and experience the richness of that core state. When I first learned this process, I literally added the word richness to my vocabulary. I mean, it's not that I didn't know it, but it's just it wasn't something that I used, and I noticed that I was using it again and again and again and again.
It's wonderful.
Yeah.
To be able to do that, and I encourage my clients to access that core state as much as they can, and it will change their lives.
As so many things in NLP, we test them to make sure they work. Can you do that in core transformation? Is there a way before the client leaves to test it? I know that you got the call back from the smoker, yes, I quit smoking, and from the drinker later, yes, but is there any way to test as you're doing the process?
Well, you know, that's interesting because I do believe in testing whenever you can. Like if you're working with a phobia, the best thing is if you can, you know, if it's a cat phobia, you can have the person, you know, be with a cat as soon as possible. Or I worked with a little boy on a bee phobia, and we went right outside and to a bush where there were some bees flying around. In this case, it's not so easy. Because for one thing, I think the process can continue working through even after you've finished the session. Sure, if you're working on smoking and the person stops smoking, you can say, oh, it worked. But like in the case of my friend with the demon, I consider the process really worked well, even though he did not immediately stop smoking. So Michael, how would you answer that? I don't have a way to test it.
Well, I think what's popping up in my mind in response to what you just said, actually, is the word generativity. That is, this is a process that you may bring some particular content to it. You might show up because you want to stop smoking, for example. But then you find out that underneath that, there's this thing that is at the ground of your being that influences all of your life. And it isn't just about smoking anymore. So smoking is certainly something that can be taken care of inside of the process. But it's wider and broader than that. And the nice thing too, Don, that I think is worth mentioning for the folks is that you don't even, this is a way to enter into the matrix. You don't really
I like that.
You don't really have to have a problem in order to do this. As a matter of fact,
Yes.
you can have something that's lovely, like I play the piano, and I like playing the piano. And you can actually use this as a way to find out what is it that the part that loves playing the piano gets.
That's right.
And enrich something that's already beautiful.
Yeah. Perhaps one test is if I feel the client is really able to access the core state by the end of the session.
Mm-hmm.
And that's kind of, you know, I'm looking at them, I'm sensing from the way they're acting and stuff that they really are accessing the core state. That's kind of a subjective test, but that's probably the best I can do.
Cool. There was a question somebody, something you mentioned actually earlier, and
Yeah.
I had a question about it because in all of my years of doing this, it's never occurred to me. I mean, I know, and of course my friend Karen here, I can see her, so I know she's going to respond when I say, well, everything isn't hypnosis, is it? But
Is it hypnosis, right?
But well, it's not just that. You actually mentioned, because I appreciate that people go into a state as they go into this process. But you mentioned that some people actually like do an induction first.
I've heard of people doing that. That's not the way it's taught.
I've never
Not the
heard
way
of
I
it.
teach it.
It's
but,
an interesting idea.
Actually, the person that originally taught me hypnotherapy, Laura West, used to do that. And okay, I feel that the process by itself is hypnotic enough.
Sure.
I mean, you start out by saying, invite the part into your awareness. Where do you feel it? Do you feel it somewhere in your body? Go inside and ask the part, what do you want? And then sit back and wait for the part to answer.
Go inside and wait is the sneakiest induction that there is.
I know. Yeah.
That's great. Wow. Well, any last story or anything you'd like to say? We've just got a couple of minutes left before we start.
Looking back on it, I don't know what would have happened if I had not discovered core transformation early on. Today I do almost nothing the way I was originally taught. Maybe a lot of us are that way. But this really set me on a path. It's my go-to process. And if you learn it, it will be one of your go-tos also.
Yeah. All right. Well, all right. So core
No,
transformation.
we do a lot of smoking clients, don't you, Don?
I do.
And so
Yeah.
would you use this on every single client who wants to quit smoking?
I don't use it in the first session, unless sometimes if I get somebody on the fence, well, I'm not sure I want to quit smoking. I kind of want to quit smoking, but I'm not sure about it. Then I might use core transformation as an exploration. I do other things in the first session, in and out of hypnosis the whole 2 hours. But then sometimes in the second or third session, there's a part of you that used to want to smoke, or maybe that still does, depending on the client. Let's explore that. I don't always do it, but sometimes I do. It's a secondary follow-up kind of thing with smoking. On the other hand, if I'm starting out with something with like cocaine, I would start out with it. That's just kind of my experience. But or nail biting.
Yeah.
Yeah.
Nice. All right. Well, it's going to be beautiful. It is, as I mentioned, the richest process that I can think of, and I truly love it. I think this is really deep, meaningful work. And if you've gotten some watered down version of it, so that you sort of think it's kind of cool, then it means that you didn't obviously take the course from Don Pelles, where you'd find out just how cool it really can
or
be.
Michael Watson.
Well, thank you. Yeah, of course. So Wednesday and Thursday, May 15th and 16th, the 2 days before the conference weekend, in beautiful Daytona Beach, this lovely beach that you all see behind me. So begin to dream about that beach and make your arrangements. And now, Don, we are going to do our thing here. We are going to open up the microphones and let everybody say good nights to you. And thanks again for being our guest. We really appreciate it.
I appreciate being on here.
Good night, Don. Thank you very
Good
much.
night.
Good night, Don.
Thank you, Donald. Thank you.
Thank you.
Yeah.
Hello, everyone.
See you at Daytona.
Thank you much.
Oh, and ladies and gentlemen, next week, same time, same bat channel, I'll be talking with Eric Rosen and Patty Scott about medical hypnosis.
Oh, nice.
And Kwitai Neal, manifesting a successful hypnotherapy practice, will also be our guest. So come back a week from now, and we'll see you then.
Thank you, Michael.
Thank you.
Bye. Bye, Karen. Bye, everyone.
Thank you. Bye.
You're